common one I see in caregivers and a lot of nurses too. Our ethics come into play. Economic abuse, making an individual financially dependent through improper use of funds in the trusted relationship. Very common also in intimate partner abuse. We're going to go over that. Okay. Half of all Americans have experienced violence in their families. Hmm. A lot of it is underreported too. Secondary effects of violence, anxiety, depression, SI. They go hand in hand. Okay. So, perpetrator versus vulnerable person. So, perpetrator is the one committing the violent act, right? Poor education. Oftentimes, they're lack of education, low socioeconomic status, substance abuse, family history of violence, low self-esteem, possibly experienced violence as a child. All of these are true. The one thing I would like to debate is the low socioeconomic status. I've cared for a lot of people in the higher I've cared for a lot of VIP clients, and let me tell you, a lot of them were the perpetrator. So it doesn't matter where you are on the economic ladder. You can be the richest man alive, and you can be the perpetrator. Does that make sense? So I don't. It doesn't matter. You can be rich, poor. You can be classified in this perpetrator category. That's the one that I can debate on. It doesn't matter where you come from. Everything else, I believe, is true. Yeah. Vulnerable person, the victim, intimate partner violence, oftentimes female and pregnant, right? Child abuse. When it comes to children, unwanted, unplanned pregnancy, children with special needs, there's an increased risk for child abuse when domestic abuse is present. Absolutely. There was this one TikTok I saw recently. They had like a little baby in the corner, and the guy is just beating and throwing his partner. Like, have you guys seen this? It was all over TikTok. No? Was it the NFL player? I guess it was him. I didn't even know that. I was just traumatized. What in the world? Yeah, I couldn't. Ugh. And elderly. He threw her at the TV, I think. Yeah. Yeah. That's what it was. Oh my gosh. Higher economic status. There you go. Frequently with giving Coke and McDonald's. Interesting question. Um, I wouldn't say that it is. Maybe, maybe that's what could be afforded. Maybe that's that's able to be purchased and given. So I wouldn't say that that's the case. Yeah, I wouldn't say. I wouldn't say. Now, if the family is able to afford, let's say, better quality, but beans and rice is cheaper though. So maybe there's like a lack of education in this case, right? Like to educate, like this is better food. Because yes, like when you're providing poor quality food and better there's a better choice that's cheaper, it can be. It just I feel like in this case maybe it's yeah, a little lack of education, a little bit of both, a little bit of both. Yeah. Yeah. I understand what you're saying. Yeah. Elderly abuse, chronic health challenges, Alzheimer's, or sometimes I walk into boarding cares to check on my patients, and they have pressure ulcers because these caregivers haven't been turning them every 2 hours or every so often, right? They're all vulnerable, right? Leads to chronic problems. Okay. Characteristic of the perpetrator. So, consider their own needs more important than the needs of others, poor social skills, extreme jealousy, and may control family finances. Okay? So, and this is really true. I used to have a neighbor, okay? My mom and I helped her get away from her perpetrator husband. Okay? He thought that he was better than everyone. He would never look you in the eye to say hello. He was extremely jealous when she would come over and visit my mom and myself and my family. He expected her to cook, wouldn't let her have a job, um, wouldn't give her the money to buy groceries to cook. So she would come over and we would notice bruises all over. Okay? Because, his needs above everyone else, and he cheated on her. He would come home. Oops, sorry. He would come home with glitter all over because he was cheating on her. Cheating um, on her because he was cheating with, I don't know where she found him somewhere. Anyway, it doesn't matter. But this was him. He was extremely jealous. It was all about him. He can do whatever he wants, but she can't come visit us. So, and they had a 2-year-old at the time. That was him. Characteristics of a typical perpetrator. Typical. Okay? Pregnancy may trigger and increase violence for women. Absolutely. So, characteristics of a vulnerable woman. So, if you're pregnant, that's also narcissism. It could be narcissistic personality behavior. Absolutely. Absolutely. All about themselves. With narcissistic personality, it's all about them, and they're not necessarily violent. But perpetrators, those who do the abusing, they can be narcissists. Absolutely. 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 1000%. And he was a freaking narcissist. Yeah. Violence may escalate when wife makes move towards independence. Absolutely. When he realized that she was going to leave him and she would come over to our house all the time, he pushed her down the stairs one day. He just pushed her down the stairs. So she came with all these, like, I don't know, it's just disgusting what he did to her. Greatest risk of violence when women attempts to leave the relationship. Absolutely. She was walking on eggshells around him at some point because he would notice that she would come over and she would talk to my mom and myself and my family a lot. And my mom would notice that she would just get worse and worse every day. So my mom was like, "That's it. I don't give a crap what he's gonna do. We're gonna help you out." Okay? We're gonna talk more about this in a few slides. For children, so vulnerable children, so if they're younger than 3 and they're perceived as different, so maybe kids who have autism or ADHD, maybe the child reminds them of someone that they don't like, reminds the parent of someone that they don't like, right? Product of an unwanted pregnancy, and interference with emotional bonding between parent and child. Sad. I just can't. With kids, I can't. Older adults. Oftentimes, the older adult who is vulnerable has poor mental or physical health, that they're dependent on someone, right? Depending on the perpetrator. Female, older than 75 years old, white, living with a relative. Maybe elderly father is being cared for by a daughter who he abused as a child. Elderly woman cared for by a husband who has abused her in the past. Very valid pointers. This is something I see all the time. Violence of the cycle of violence. This is where my neighbor comes into play again. Okay? Tension building stage. So, it's like the perpetrator is a ticking time bomb. Okay? Abuser becomes judgmental, threatening, unpredictable, verbally abusive. Victim feels like they are, typo, walking on eggshells. Attempts to reason with or calm the abuser is unsuccessful. So this is what happened to my neighbor. She didn't know how he would be when he came home. She confronted him one time that he was cheating on her, and we would hear all this screaming and yelling, okay, and just things like it looked like there was an explosion. It was horrible. Horrible. Okay? Horrible. Walking on eggshells, because then it would lead to acute battering stage. Explosive phase, this is where he would physically abuse her. Absolutely physically abuse her. Okay? Physical, emotional, and or sexual abuse occurs. Victim may contact the authorities. I contacted the authorities on him. She contacted the authorities. My mom did. I mean, it was horrible. So Of course, he got scared that 911 was called. So then afterwards, it led to the honeymoon stage, where they buy gifts and they say they'll never do it again. And so the victim drops the charges, which is exactly what happened, right? Because they think, well, he apologized. He's not gonna do it again. But then the cycle repeats. Oh, honey, I'm sorry. I'm never gonna do it again. Blah 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 blah. But it's gonna happen. But it happened over and over again, until one day, she left. Right? Sad. Sad. Signs of abuse in infants. Shaken baby syndrome. Pretty sure you guys have heard of this. Yeah. Shaken baby syndrome. So, poor feeding, irritability, lethargy, vomiting, seizure, periods of apnea, retinal hemorrhage. So, whenever I sometimes used to float to the ER, well, not sometimes, a lot. Got floated there a lot. And if we got a baby, an infant, the parents would come in like, oh my gosh, he's just not eating. Like, I think he's getting sick. And I would, if he was 6 months and younger, or he was like 7, 8, 6 months or younger, I would always inspect him to look for bruises. They're not supposed to have bruises at that stage. They're dependent on the mom to hold them, on the dad to hold them, and that's how they that's how they go by their day. So if there are any bruises and they can latch on to eat properly, and then maybe there's a seizure. If they say, "Oh my gosh, she had a seizure the other day," that's like a ding 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 shaken baby syndrome. Okay, so if they report seizures, if we inspect retinal hemorrhage, okay, periods of apnea, vomiting, poor feeding is the key here too, and bruises, shaken baby syndrome. Absolutely. Signs of abuse, preschoolers and adolescents. So, okay, so bruising on cheeks, neck, butt, genitals, and back is not supposed. They're not supposed to be bruised. You're not supposed to notice. Sorry, any bruising. Okay. Accidental bruising typically occurs in the extremities because they're playing around and they're falling on the playground and bruising, bumps. They don't care. They want to have fun. That's fine. But if I see bruising on the back, butt, genital, neck, cheeks, no, that's not okay. That means I'm suspecting some form of sign of abuse. Okay? Bruises in the shape of a burn mark. So cigarette, they will take a cigarette and they will what's the word for this where they try to, when they're done and they kind of stomp their foot. So they do that on the child or on the teen. Okay? Or a mark, a bruise in the shape of a causative object, whether it's a belt, a stick, right? Or forces immersion burn marks. So, like sticking their hands into hot water or their legs into hot water. It's horrible. It's disgusting. Believe it or not, like this disgusting stuff occurs. These people don't deserve to have children. And then with older adults, vulnerable, right? Pressure ulcers is something that I notice very common. If I walk into a unit, okay, and onto like let's say boarding care or nursing facility or a home, and my patient has developed a pressure ulcer, I'm gonna ask them, well, when's the last time you changed them? When's the last time you moved them? And they'll be like, a few days ago. I'm like, no, not okay. Neglect, right? Abuse, absolutely not okay. Okay. So basically, what you want to watch out for is incompatibility between the story, what the parents tell you, or whoever the perpetrator is, versus the multiple injuries in various stages of healing. If they do not correlate, that means you're suspecting abuse. Okay? If they're not correlating and there's lots of like holes in the story, not good. Suspect abuse. Okay? More signs of abuse: emotional, sexual, and neglect. So emotional, overly compliant or demanding, extreme passivity or aggression. Okay, kind of like they're already passive. Someone who's being emotionally abused, when they keep hearing the emotional abuse inflicted upon them, they kind of don't care anymore because they've they've been experiencing it for such a long time. They're numb to it. Okay, they're numb to it. Delayed physical or emotional development. Sexual abuse. Okay, this is something, if you're ever going to be school nurses, or you're working with kids, or patient walks into the ER, just in your day-to-day life, watch out for this. Suddenly, like, this person and they're fine, right? But then all of a sudden they have difficulty walking or sitting, right? Exhibits strange or advanced sexual behavior. Do you remember I told you guys a story about the 8-year-old who was trafficked by her father, raped, all that stuff? She was exhibiting strange sexual behavior for an 8-year-old. Like, she was dancing to provocative music and touching herself. Like, you're 8, okay? So there's that. Sexually transmitted infections like frequent UTIs and a new onset of bedwetting. Okay, all of these. If they're telling you all of this, or if you're noticing all of this, sexual abuse. Okay, neglect, frequent absent from school, frequently absent, begs or steals money for food, and if it's like raining and they're wearing like short sleeve shirts and flip flops instead of closed shoes and warmer clothing. So unclean clothes, they smell bad, poor dental. All of this is signs of neglect. Neglect, things you should watch out for. Nursing care. So what the heck do I do? Okay, so with abuse. In the next chapter, I dive a little more in depth to this, but let's do this. So assess patient as soon as possible. So the patient comes in and they maybe report abuse to you. Assess the injury immediately. Provide immediate care for the physical injuries. You're going to get consent, and you're going to say, I need to take photos of this. Is that okay with you? Because this is a forensic type of assessment. This might go to court. You don't know. So you need to have it documented while the injury is fresh. Okay? You're going to get consent to do that, and you're going to document it and take a picture of it, of all of it from head to toe. Interview the patient separately. Provide privacy. They're vulnerable. Something horrible just happened to them. Okay? By the way, if your child if you suspect abuse, child abuse, it's okay to ask the family to step out. You can ask them to step out, and you can have another nurse present while you're interviewing the child on their own. Okay, that's totally fine. That's completely okay. Ask them to leave. Absolutely. Because a lot of the times the child is afraid of the parent there, and they're not going to open up to you, right? So report suspected abuse. I don't care if you don't have evidence. You don't need to. This isn't like Sherlock Holmes times. Okay, you suspect it, you have the facts and the circumstances, you report it. There's no time to play detective, no matter what you suspect. What if they refuse to leave the child? Good question. That's happened many times. And what's happened is, in this case, I've asked for another nurse to come in with me and to speak to the child. I've always done that. It's okay. You can't force them to leave, because at the end of the day, if you're suspecting something, you're going to report it. Does that make sense? If they refuse, they refuse. It's fine. You can't force them to leave. What I usually do is I just ask, okay, so my colleague is going to come and stand with me as I ask a few questions, because you don't want to be alone when you're asking such deep questions to the child. Does that make sense? You want to make sure you have another witness watching you, you know? Yeah. At the end, report it. If you suspect, you report. Collect and prepare evidence for legal purposes. Absolutely. Work with the patient on a safety plan. Right? So this is with sexual abuse. You definitely are going to work on a safety plan upon admission. You're going to teach them what are some signs and symptoms that lead to abuse. Like, that abuse is escalating again. There's a high chance that this might occur. You're going to have a safety plan. Right? If this happens, here are shelters and here are safe houses. You're going to provide them with the resources available. Okay? Risk for injury, risk for violence. I don't. Since NANDA is no longer a thing, the world's changing. NANDA is no longer a thing. Okay, implementation. Obviously, trust and report. If they don't trust you, forget about it. You're not going to care for them. They're not going to open up. I'm repeating this one, but report abuse. All abuse is reported, even if you're suspicious. Okay. For women, refer the women to shelters. So, oftentimes these women who've been abused, they're afraid to return home. Relatives and friends, maybe they don't have a lot of relatives or friends, or maybe they don't want to verbalize this to relatives and friends, and they have limited financial resources. So, women's shelters, that's what you're referring. You're going to give them lots of brochures, lots of referrals. That's instead of family or friends, it's the shelters. Okay, uh, I'm going to speak a little more on the safety plan in the next chapter. And then there's case management, provide therapeutic environment. So case management is where the social worker comes in. You know, um, social worker comes in, the doctor. It's like a multidisciplinary team, and we decide what's going to happen. This is where you're going to go. Promotion of self-care activities, health teaching and health promotion, right? Therapeutic environment, milieu therapy. So this is important too. I don't know why sometimes this happens. Come on. Okay, so this is important to educate all your staff on and for you to keep in mind. So when you work in the ER and you care for a lot of patients who go through abuse, you will get a lot of walk-ins who report, I've just been physically abused or I've just been sexually abused. So this is what you need to understand: risk for suicide, coping patterns, support system, and alcohol abuse. Okay, so the patient may feel desperate and trapped and view suicide as the only option. So when your patient comes in for abuse, you're assessing for suicide because they think that this is the one way to stop it from happening. Then you're going to assess for their coping mechanisms. Do they have any? Assess the patient for individual family strengths and strengths. Do they have family? How do they cope? Do they have a safety, like a safety net? Do they have someone they can refer to? How do they cope? Right? What's their support system? Patient may be independent and isolated, unaware that there are shelters available if they have no support. And substance abuse. That's the coping mechanism for a lot of these guys. They don't know what to do, so they dull down the pain with drugs. So all these four factors you're going to educate your staff on, and you're going to make sure you keep that in mind when you're working with abuse patients. Okay? I promise you it's on the exam. Okay? So again, primary, secondary, tertiary care. We always talk about this. Primary, measures taken to prevent occurrence of abuse, educate, right? Secondary is early intervention, screen who's higher at risk. And then the third is, okay, so it happened. Let's care for you. Let's provide resources. And let's assist you as a survivor to achieve your optimal level of safety and health. Okay? You guys know cognitive behavioral therapy and psych go hand in hand. Okay? They're going to refer them to individual therapy, maybe psychotherapy, family psychotherapy, or group therapy. Therapy is always there.